at FCA and certainly the team here at Thrive. And the other partners with FCA are?
LICAD, the Long Island Recovery Association, and FIST, Families in Supported Treatment.
Okay, you heard that. LICAD.
Jasmine is here somewhere in the room.
Yeah, okay. So that's that is absolutely a great team. It's an important discussion that we're having, and I hope this report will add to the important discussion that we're having on this issue, and I think Jeff framed it beautifully in terms of how serious this discussion needs to be, how much more work we need to do. I also want to acknowledge the great work that Jeff has done in this area. Anytime there's a comment that needs to be said about the issue of opioid addiction and what's been happening, you always see Dr. Jeff Reynolds quoted, be it in Newsday or in any other media, because he really has led this great team here at FCA to really be on the forefront of addressing this issue and so many other issues. Jeff Mesdrum, we know each other for a long time. I knew him before he was a doctor. I knew him before he had his master's because he was one of my students when I was an adjunct professor at CW Post. He did earn an A from my class. I want to make that clear. So, and you know, going back to the days of the AIDS crisis on Long Island, he was a leader there. He headed LICAD for a period of time, and obviously in this role of being president and CEO of FCA, he continues to do important work. And I just have to say about FCA, I've seen the evolution of the organization over the years, and certainly when I was in the Assembly, we worked very closely with the organization then. But if you're looking about this great Long Island for a not-for-profit that's going to be there to service people, particularly families, particularly children and seniors who might be in the shadows or might be left behind, FCA is no doubt going to be the organization to be leading the way to provide important services. So how about a round of applause for the FCA team headed by Jeff Reynolds. And what a great turnout of community leaders. Thank you all for being here. I wish I could introduce every person in the room. I can't, so I won't, but I appreciate that you're all here. I appreciate that with the modern technology. We have a lot of folks joining us live on Facebook, and thank you for being with us as well. Jeff started down the path of introducing electeds and thanking those who've been particularly helpful, so I will round out that list. He mentioned Senator Anna Kaplan. You're going to be hearing from Anna in just a few moments, but also I do want to acknowledge again our State Senator John Brooks is here. Give him a round of applause. State Senator Kevin Thomas joined us. There he is there. So one of the state senators who I think has just done an extraordinary job for everybody on Long Island, and I very much regret that he's graduating from the state Senate and going on to have a real life, but he really has just done an incredible job, and it's so great to have Jim Gorin, Senator Jim Gorin in our company. Already mentioned as a great ally for FCA, Assemblymember Judy Griffin is here. Thank you for being here, Judy. We have County Legislator Arnie Drucker is here, right here in the front row. Assemblymember Chuck Levine was going to join us, but he couldn't be with us today, but Matt Cantor from his office is here. There he is back there. Give him a round of applause. And we have some of our North Hempstead Town Council members. They are wonderful people. I'm very proud that I live in North Hempstead, and these are individuals who are doing a great job. So give it up for North Hempstead Town Council members. Wait, I didn't say their names. I want to show that you really mean it. Let me say who they are, and then you got to give an even louder applause. Veronica Lurvy and Peter Zuckerman are here. Okay, there. And we're also joined by Town of Babylon Council member Dwayne Gregory is here. And our former county legislator and town clerk Wayne Week joins us. Thank you, Wayne. Plainview Water District Commissioner Amanda Field is here. And if anybody snuck in, someone will hand me a card and tell me what I hear. But again, thanks everybody who came out for this important presentation and discussion. So we're releasing our report today. Hopefully you all have a copy of it on drug overdose overdose deaths during the pandemic. I mean, that's really the main point of this, to give us an update as to where we're at today, as we hopefully have this time of the pandemic more in our rearview mirror, and the tragic surge that was experienced here in New York State. I think, as you know, we're the Comptroller's office, so we're not the policy shop. That's what the legislature and the governor do. But we try to analyze the vast amounts of data that we have access to present reports, or sometimes we draw on the audit work that we do to help inform a more thoughtful discussion among policymakers, community stakeholders like the community leaders here, certainly the not-for-profit organizations like FCA and allied organizations. So this report is meant to contribute to what is already a very important discussion that's been going on, and recognizing that a lot of important work has been done here in New York, both by government and certainly by the not-for-profit sector, and working in collaboration with community leaders and community groups. So it's not meant to be an answer to the challenges that we're facing, but it's meant to be a document to help us all understand where we're at today, so we have a better sense about where we need to go to really address this serious problem. So we have a policy shop that works in these reports. I want to acknowledge Maria Doulis, who heads that shop. Where's Maria sitting or standing? Did I lose her already? Oh, there you are. You're way up. Okay, Maria, give her a round of applause. Maria and her team put this report together, spent a lot of time on it, and appreciate, as always, our Budget and Policy Group's efforts. So we all know the COVID-19 pandemic has been a very difficult and stressful time for everyone, and certainly for those living with addiction. It's been especially hard given the isolation, the fear, the uncertainty, some of which continues, even though we're obviously in a much better place than we were going back 2 years or so ago. Drug overdose, so I'll just give some of the highlights of the report. Obviously, there's a lot in here. Drug overdose fatalities surged during the pandemic. Opioid-related deaths increased by 68% between 2019 and to 2021, claiming the lives of nearly 5,000 New Yorkers in the year 2021 alone. The surge was largely due to a significant increase in deaths from opioids with illicit fentanyl and similar synthetic opioids. Overdose deaths statewide from opioids and all drugs in 2021 surpassed the previous 2017 high by more than 1,700 fatalities and are nearly 3,900 greater than in 2010. So we see a trend going very much in the wrong direction. These numbers are alarming. These are tragedies that devastate families, impact our communities in countless ways. Jeff certainly gave voice to that in the introductory remark. The data clearly shows that our battle against overdose deaths is far from over. So the numbers, again, just to emphasize some of what we found in the report, 85% of drug overdose deaths involved opioids in the year 2021. The rise in fentanyl-related deaths has been shocking, growing from 11% of all drug overdose deaths in the year 2010 to 78% of the deaths in the year 2021. Dramatic change. Fatalities grew across all racial and ethnic groups. Death rates for all drug overdoses increased fivefold for Black New Yorkers, quadrupled for Hispanic or Latino New Yorkers, nearly tripled for white New Yorkers. Here in Nassau County, there were 20 deaths per 100,000 in the year 2020, up from 7 in the year 2010. In our neighbor Suffolk County, there were 30 deaths per 100,000 in the year 2020, up from 13 in the year 2010. Some other areas of the state had even higher rates in the year 2020, including Dutchess County, Niagara County, the Bronx, and Monroe County. In terms of the trends that the report identifies, for the better part of a decade, drug overdose deaths were on the rise both in New York and across the country, growing 152% in our state between the years 2010 and 2017, compared to a growth rate of 83% nationally, so a much higher number here in New York. Again, looking nationally, opioid-related deaths grew from 55% to 68% of all drug overdose deaths from those years, 2010 to 2017. Opioid overdose deaths surged by 200% in New York between 2010 and 2017. Then we actually started to see some progress. You'll remember 2017, the federal government declared a public health emergency with regard to overdose deaths, and we saw some progress. Opioid deaths actually declined in New York, and then the pandemic hit. And then we saw the increase once again, growing during the pandemic by 68%. So one of the roles that we play, obviously, in the Comptroller's office is monitoring the state budget. So just to give some context in terms of the work that our legislators have been doing, working with the governor, New York has increased opioid-related spending from $187.2 million in fiscal year 2011-2012 to $246.2 million in fiscal year 2020-21. The state is expected to exceed $500 million on opioid-related spending this year. $209 million of that total is coming from the opioid tax and litigation settlements with pharmaceutical manufacturers and distributors. A portion of settlement funds secured by State Attorney General Letitia James. And hasn't she done a magnificent job in this area? How about a round of applause for our Attorney General? So a portion of those funds will be deposited or are being deposited into the opioid settlement fund. And I think, as many of you know, an advisory board is required to recommend allocations of funds by November 1st. Coincidence? Annually. The board met and voted yesterday. I don't believe their report is on the web yet or public, but we expect to see that pretty soon. And they outlined their priority areas, so we'll just see how the funding is actually going to be earmarked for the priority areas that they laid out. So there's still a lot of work for us to do. I mean, that's the main point. I think that you know already. That's not a revelation. Again, our report is meant to be a snapshot, a picture in time as to where we're at, because I think we already know there's a lot more work we need to do. So collectively, and we hope to play a role in this, we need to improve efforts to track funding, because current financial reporting doesn't always clearly identify the totality of state, federal, and local resources that are dedicated to addressing the opioid crisis. We also need to set clear performance targets and regular reporting on program outcomes. That's always, I think, one of the challenges that I find in government in New York State. We often do a good job of identifying a problem, even coming up with money to spend on a problem, often with a great announcement, but we don't always do as good a job to do reporting on milestones, reporting on progress, even being honest if our progress is falling short. That's true with any number of programs, so I think that would be helpful, particularly in this area, given the human toll involved. We need direct funding and support for communities facing the greatest challenges. There's no doubt, when you see some of the more detail in our report, that communities of color are, certainly through the pandemic, were affected much more so than other communities. We need to target funding in that regard. Our youngest neighbors, young adults, really have been feeling the brunt of the mental health crisis that we're all going through right now. In fact, our friends at Newsday just yesterday, I saved it, schools focus on mental health, and quite a story about the anxiety that so many of our young adults are feeling. We don't want them to fall into the trap of addiction and, God forbid, drug abuse, and God forbid, drug overdose. So we need to target more carefully what we learned painfully through the pandemic, and which communities particularly need to have our focus and to have our attention. Jeff Reynolds spoke eloquently about the human toll and the loss, and you can't put a price tag on family members that are no longer there. But another way to look at it is just look at all the dollars that we've lost. Look at the economic impact of those lives lost, what they could have been had they been able to live their lives, have a job, have a career, whatever their chosen field would be, how they could have given back to the community and to the economy. It's a human loss, it's an economic loss. We need to do a much better job in this area, and I'm really grateful to FCA, to Thrive, to leaders like Jeff Reynolds, who don't shy away from saying, we have to do better, we have to do more. And it's great to be here in this recovery center, knowing that here on Long Island, we do have options to try to help people. So, enough from me, but I want to call up someone who's been a great champion, a great fighter in this effort, someone who, as Jeff indicated, has helped to secure funding for this recovery center. It shows where her priorities are at. Anna Kaplan is the state senator for the 7th Senatorial District. She happens to be my personal state senator, which is a nice thing for me. She chairs the standing committee in the state Senate on Commerce, Economic Development, Small Business. She's a fighter for so many issues and causes, certainly one of the most effective lawmakers we have in Albany. I know she cares very deeply about this issue that we're talking about today. So without further delay, let me call forward State Senator Anna Kaplan.
Thank you very much. Good morning, everybody. I want all of us to give a big round of applause to our wonderful Comptroller, Tom DiNapoli, and for his staff doing this great work, trying to come up with ways that we could actually help all those who need our help. And as Jeff said, every life counts. Every life that we lose to drug overdose is a loss for all of us. And I want to thank Jeff and FCA and Thrive for all that you do. It is really great to have partnership with you to make sure that we do everything possible in Albany to give you the support that you need to help all of our residents here in Long Island. As we all know, the first step in addressing a problem is understanding it. And thanks to Comptroller DiNapoli's new report on the overdose crisis in New York, we have a roadmap for how to better support New Yorkers who are struggling so that we can stop the senseless tragedies that are impacting far too many of our families in our communities. Implementing the recommendations laid out in the Comptroller's report will require the coordination and attention of every level of government. And the works of supporting people in recovery falls to every member of our community. I think I speak for everyone standing here when I say we're ready to get to work, to implement Comptroller's recommendations so that we can better assist our friends and neighbors who are struggling. And I look forward to our continued partnership to attack this crisis from all sides. Thank you, everyone, for being here, and thank you, everyone, for speaking out. Appreciate it.
Jeff Reynolds and the team here have been very kind in hosting us. I want to turn it back to Jeff for a special introduction, and we have some very important words from our next speaker. So, Dr. Jeff Reynolds.
Thank you, Tom, and thanks for your work. You've found a way, I think, to extend the reach of the Comptroller's office beyond counting money, beyond 529 plans, beyond unclaimed funds. Do you have any? To delve into the important policy issues, whether it's New York's environment, whether it's social justice, whether it's public health. You found a way to expand the office and the functions, and we appreciate that, and thank you for this report. Next time you'll come, it'll be better news. Hopefully we will have made some progress. I want to just thank the FCA staff. There are several staff people in the room. I'd be remiss if I didn't introduce or at least shout out our Chief Operating Officer, Lisa Birch, who oversees all of our programs. There are several other members of the C-suite here, Angela Montemorano, Ira Berkowitz, Paige O'Brien. And I also just want to talk about the staff. You know, during COVID, we did an amazing job, I think, acknowledging frontline healthcare workers, doctors and nurses and folks who put it all on the line during COVID. We didn't do as perfect a job acknowledging social workers who were in the trenches then and who remain in the trenches now as the world is taking a deep breath post-COVID. I'd say that with some amount of tenuousness. The reality is, and Tom held up the article, that the mental health consequences of COVID continue. We saw the overdoses spike firsthand here during COVID. We saw the mental health symptoms. We saw alcohol use go up 35% during COVID. We saw kids unable to go to school. We saw families unable to function. We saw domestic violence cases go up. We saw child abuse cases go up. And so far, that hasn't gone away, and there are folks now who have been in this mix for 2 years plus, doing the work day in and day out as unsung heroes. Here at FCA, we believe that there's a role for social workers and folks for lots of letters after their names, and that's a great thing. But there's a very important role for folks that have the lived experience. And we've always believed, whether it comes to addiction or mental health services or combating gun violence, that those people who are closest to the problems are also closest to the solutions. And we've made a commitment here at FCA to hire folks that have that lived experience, to shape our programs, not as volunteers, but as compensated staff people who have an equal seat at the table. And so this morning, it gives me great pleasure to introduce you to one of those unsung heroes. Please meet Samantha Morales.
Thank you very much, Jeff. I just wanted to say thank you to Senator Kaplan and thank you to New York State Comptroller DiNapoli. Thank you. I stand here before you today to say that it's very sad. These numbers are very, very sad, but it's really not a surprise to us, those that work in the field of recovery. I'm here to say to you that I know this is all doom and gloom, but I stand before you to tell you, as a person in recovery, I am also a survivor of a near-fatal overdose. In January of 2020, I survived a near-fatal overdose in my kitchen, and I had to be Narcan 3 times, and if it wasn't for the paramedics Narcanning me 3 times, I would not be here right now. So I'm here to show you that we do recover, and there are success stories that you do not hear about. We just kind of go on with our lives. You hear about these statistics, but you don't see and hear about the people that move on with their lives. I sought out treatment after my overdose to inpatient rehab, and I did intensive outpatient, and I slowly got my life back together. I saw a job posting for Thrive, and I was hired by Ryan Kaiser, and I jumped at it. And I was hired as the recovery housing peer advocate. And I have to tell you, working for Thrive FCA has been a life-changing experience for me. People in recovery need to connect with other people in recovery. We tend to isolate, and what's the opposite of isolation? It's connection. I have to tell you that I look forward to coming to work every single day. One of my happiest memories of working in Nassau County is going to New Hope, the crisis center, every Friday and meeting people who have just come off the street, and they're just happy to have somebody to talk to them on a person-to-person level. And you can't put into words how great it feels to just meet on like that heart-to-heart level. Our stories may be different, but the desperation is the same. The highs are the same. The lows are the same. It's just, you cannot put into words how it feels to connect with someone. I was very lucky. I now work at East End Thrive out in West Hampton Beach. And it's amazing that I get to meet more people in recovery, and I get to spread what I've learned here and what Thrive FCA is all about. So, like I said, I stand here before you today and tell you that I am the survivor of a near-fatal overdose, and we do recover, and places like FCA Thrive are very important to people in recovery. Thank you very much.
Samantha, I noted you were the only one that got a standing ovation. I hope you noted that. And I decided I'm writing your name in for state controller when I vote next week. Okay? You got one vote. If I lose by one vote, then we know I did it to myself. So you're a beautiful person. And I think your message is the most important message of today, which is the message of hope, the message of possibility, the message of supporting programs like FCA and Thrive makes a difference, and that you're back in helping others. You know, one of the points that we've made in the not-for-profit reports that we've put out over the years is how much a part of the state's economy and the jobs picture the not-for-profit sector is. And one reason why that impact needs to be appreciated is that very often, Samantha, folks like you who needed services and in a sense are a client end up then becoming one of the employees and then helping others. So trying to get people back into a fulfilling career, the not-for-profits do that better than any other sector of our economy. So how about another round of applause for Samantha for doing a great job. Thank you. So we have so many wonderful electeds here. I did want to give a chance, Senator John Brooks, who, as you know, has been a great supporter of this program and these efforts as well. Very hardworking member of our state Senate, a good friend. John Brooks, come up and say a few words.
Thank you, Tom. And Jeff, I had an opportunity when you opened the first Thrive back then. This is a real problem. So I want to go back a short time, 53 years ago, when I first got involved in the fire department. One of the first calls I had to answer was an overdose in the back seat of a station wagon. And when I looked in the station wagon, I saw my friend Kevin, who was one of the top sprinters in the area, dead, months after getting out of high school. This is a real problem that's gone on a long time. You know, in the fire service and with the chief, there are times when we saved somebody because of Narcan and other things. But sometimes you couldn't understand how you came to the same house sometimes 2 and 3 times in a week and nothing was done. And then one day, nothing could be done. We all have to recognize how dangerous this is, how real it is, and recognize when people are put under stress, sometimes people succumb. So Tom is famous for the unclaimed funds report. And everybody thinks he's a miracle. I got people called the guy, is this a con? No, the money's there. This report, it's the unlived report. The people who didn't get to live out their lives. And we have to put the effort into this as we've been doing and realize this is very, very, very real. And for me, my involvement is now more than 53 years of watching this happen. So I thank everybody, Tom, for your work, Jeff, for everything you're doing. We're making progress, but we need more touchdowns. So let's make the upcoming year a Super Bowl year. Let's really turn this around, state. Thank you very much.
Thank you, John, for sharing a personal testimony, seeing it up close. Jeff mentioned another great supporter of the program, delivering in tangible ways. I'm going to call her forward, Assemblymember Judy Griffin.
Thank you. Thank you, Comptroller. I'm losing my voice a little bit. Good morning, all of you. I'm so happy to be with you today with all of these people that know how much this matters. So I'm honored to be part of all of you in making the strides we are all trying to make. I want to thank Comptroller DiNapoli, Dr. Reynolds, the entire board and staff at FCA and at Thrive Recovery. I am always on board to support FCA and Thrive as I did this summer when nothing made me happier to have a big check to give to you, because I know what a difference you make in mental health, addiction, recovery, suicide. You guys really get it done. I've seen, the tour that I went with Lisa Stern Birch in Freeport to see young people making their lives over and making such a difference. Samantha, I just want to say congratulations to you. You are just an inspiration to all of us in this room, and I'm sure make such a difference every day when someone who doesn't know what's going to happen next meets you. And you show us all why the work we all do collectively matters. And I just want to thank you for your experience and for sharing it so beautifully with all of us. And I want to say, this stark increase in fentanyl deaths has ruined the lives of far too many families. And my college roommate in 2018 lost 2 children in 6 months. And they were the same age as my 2 oldest. And when they passed away, they were 23, and then 6 months later, the older one, 25. And they're just an everyday family. It just shows you it happens to them, it happens to someone else. And I saw through them, just in the little window that I saw through them, how much more support families need in recovery, because that's a big aspect that sometimes they don't get all the recovery they need. And so I really want to thank Comptroller DiNapoli for this report he gave today with the in-depth focus on what we've done, what we need to do. And I think it's so important to focus on the allocation of funding and then notice what are the results, because we want to know that our funding is going to the right places. So I thank you for that, and thank you for your continued efforts to show us where the money's going, what we're doing, and how we can be even more successful. So thank you to all.
Thank you. Picking up on what the Assemblywoman was saying, which is something Jeff reminded me of the other day, and we added it to our report. Money is an important part of it, obviously. You need the resources. But programs like this are facing the challenges that are happening in workplaces all across our state, not just in the not-for-profit sector. Workforce issues, finding the people to do the job, recruiting them, and then retaining them. We're facing it on our own agency at times, and I certainly hear from many of our small businesses. So some of the support is not just about dollars, right? It's about dealing with those workforce issues that are plaguing all of us in this unpredictable, post-COVID economy that we're all going through. So let's be mindful of that as well. So we've had, I think, important words said, most important by Samantha. But I know several other electeds came in before I had a chance to speak to them. Some were here. Does anybody else want to offer any thoughts before we close it out? I know it's dangerous to offer a microphone to electeds, but I don't want to be considered rude. You want to do a valedictory statement there, Jim Gorn?
Just to thank you so much. As Jeff said, you have made the policy a major importance as well in your work, and that will be saving lives.
No, we'll try. We'll try. Thanks again for everything you've done. It's good to see you. So I think I'll wrap it up. We'll be available for the press offline. I want to thank again Jeff Reynolds and the team here at Thrive and FCA for hosting us, but more important than that, for doing such impactful work. There are solutions. There are lifelines. Samantha, you made that very, very clear. God gave you the opportunity to continue to live, and you are doing so much to help others. And that really, to me, is the punctuation point to what our report is all about. So thanks to everyone for being here. We're around for questions or comments, and the report is available online. Copies are here. And again, especially for our policymakers at the state level, but even beyond, we hope that the analysis here and our suggestions for where to go from here will be helpful in the ongoing conversation about how we address this continuing crisis more effectively than we have in the past. Thank you all. And thank you for watching on Facebook Live.